I'm sure it's hardly any difference here. I'm doing work right here. It's kind of far away because I forgot the macro lens. I haven't done it in a while.
Let me move it down just a touch more because it's still kind of mostly on her. Let's try that. That's probably better.
And I can zoom in too later, but we'll see how the quality changes. So. Okay?
Yeah, that's better.
Okay, good. All right, I'll give you a measurement here. The measurement is 0.8 by 0.9, I'd say. And I'll let you wrap the. So this is a keratoacanthoma. It doesn't look like much now on our forearm, but it was a keratoacanthoma. It looks like kind of like a little volcano, like a little bump that's raised up on the skin. So we took a biopsy of it, and sometimes they come down a little bit. Sometimes they actually get angry and go the other way and grow really fast. So you're lucky it went down a little bit, but we're going to remove it more completely by doing an excision here. So we're going to remove it. So I kind of drew around it and drew the direction we would do this, and I gave it a couple millimeters extra around it because we got to make sure we get it off, and we're not doing Mohs on this surgery, meaning we don't remove it and check the tissue while we wait. But we will check it. We'll check it after. We'll send this tissue in and check it under the microscope. Okay. So I already numbed you, and you shouldn't feel anything other than my touching you.
Right.
If you feel anything uncomfortable, you make sure you let me know. Okay, at any point, yeah. We let it sit for a little when we numb because it.
So take effect.
Yeah, and there's epinephrine in the area in the numbing, which helps to constrict blood vessels so that it's temporarily prevents it from bleeding as much. So it makes it easier for us too. So all that kind of stuff, we want it to take effect a little bit. So that's a piece of tissue that we're going to bring in to send under the microscope. And now I'm just going to do what's called undermining, meaning we kind of loosen the skin around the area so that we can pull it together and it won't be real tight, and it will make the scar. If we didn't undermine, if we just kind of pulled it together, it could stretch because there's more pull. The sides of the scar can cause it to stretch more and like be more like a football shaped scar, you know, like a stretch scar. Go, just in case I need to. I'm gonna buzz this here a little bit. It's a cautery that stops baby blood vessels if they're oozing. Looks like you're pretty well behaved. I don't have to do too much. There we go. And then I'm going to use my suture, a little 4-0 Vicryl underneath. So we'll send that tissue in. Here in this case, we're going to probably have you come back in 2 weeks to take these stitches out. Or you might be able to take them out yourself, although they are on your right hand, so right arm. So that's a little tough for you to get.
To do.
But you can, or somebody can for you.
Yeah.
But we'll make an appointment for you anyways, and if you can't, find somebody or you don't feel like they don't feel confident doing it, we can.
My grandson's an EMT. Maybe
I bet you he could do that. Yes, we'll show you how to do it too. I think we've shown you this kind of suture before. I think maybe not. Okay, this is a different kind of suture. It's very easy. You just actually essentially just snip one knot.
Okay, and then pull.
And then pull the rest. Mm-hmm. So lunchtime today, we're doing this, and then we're gonna go have lunch. And not too bad of a Monday so far, I should say.
Good.
It actually moved kind of quicker. Maybe I'm getting used to doing this in the morning.
Do you do your surgeries mainly in the morning? Or?
No, I do surgeries a lot before lunch. But like in the past, I've been doing more like cosmetic surgery or Mohs surgery in the morning, and I've been adding more regular clinic days in the morning, and it's just hard to get used to because you're used to a certain kind of pace, and then if I had in my mind, it's so strange because you have in your mind that when you do regular clinic patients, it's sort of the end of the day, like the second half of the day, and when you start doing the morning, it's kind of depressing because you're like, wait a minute, I feel like it's like you feel like you're doing a double day.
Yeah.
So
that makes sense.
Yeah, there's one little baby vessel that wants to ooze just a little bit. So We always do this anyways. We're gonna give you a little wrap on your arm.
Okay.
It kind of keeps it snug
Pressure.
yeah, exactly. A pressure dressing, a little pressure. Obviously, if it's cutting off your blood supply, I mean, it's making your fingers numb or anything like that, you know, make sure you loosen it, okay? But we're gonna keep it snug at least through the night so that to make sure it doesn't get a hematoma, like a little. Can you just stab one more time? Excuse me. Okay, let me see if I can come at this. I might have to switch sides with you, huh?
Okay.
Okay, thank you. I'm gonna come over here for everybody. Let's see it this way. Because at this angle, I want to do my running stitch. So I'm gonna come upside down here. So we extend it. It's a little bit full still on this side here. It's called tenting, where we have a little bit of extra skin. It kind of makes it pooch up a little bit there. But
my nose did that.
Yeah, and they settle down. Yes, it'll settle down. It's actually not called tenting here. This is called a dog ear, potentially, like a little bump on the edge.
Cute.
Yeah. Puppies on your mind kind of thing.
Yeah.
But that actually, from what I see here, and that your skin here is, it's gonna settle down. I mean, sometimes I see it and we need to take a little extra bit of tissue on the sides, but I don't think we're gonna need to with this one. I think that's gonna settle down just fine. So in these cases, I put a running stitch on the arm so that you can leave the stitch in for longer. And it gives it strength, keeps it strong for longer, and it's easy for you to take out too. So you can have it taken out yourself in 2 weeks instead of 1 week.
2 weeks.
Yeah. On the face, I don't do these kinds of stitches. Oh, see, there's that little vessel. Let me see if I got it, or dab again. Let me see if it's still in there. Let's see, it must have gone right over it. It looks like it's venous blood, though. You can see it's a little darker. Then you just have a little vein that wants to ooze a little. I think it's going to stop here. Looks like it stopped okay there, but just got to give it extra dab each time just to make sure. And we'll definitely give her a pressure dressing.
So I should leave that on till tomorrow?
Yeah, and even when you're going about your business, you know, for the next couple weeks even,
Keep that covered.
Yeah, because you know, it kind of keeps it snug in case you're doing something that's high impact and it could pull the stitches like like you're hammering or banging down on something.
Okay.
It can cause a little bit, it can cause a suture to break. Loosen that a little bit. Let's take a look at it here again. Good. So a little bit, I want to make sure that it's not oozing under there. So just fullness because we put numbing under the skin. She's going to give you a nice little wrap, and we'll see you in 2 weeks unless you're going to take it out yourself, okay?
Okay.
Thank you.
All right, I'll go ahead and make the appointment.
Okay, yes. Perfect. That's exactly what we would like you to do. There you go. Okay.
And then you're gonna.
Yes, I'm gonna freeze that. I'm gonna freeze that. I'll take my camera and freeze that.
That was quick.
Yeah, I don't mess around. It's lunchtime, girl.
This is a little. Time to go eat.
I have glove dust on me, but this is a little. I bet you kind of scratch at this one a little bit.
I think I did. Yeah, I thought it was like a little pimple at first.
I think it's just been scratched that, so it makes it raised and rough.
Yeah.
I think it's a keratosis, a benign keratosis, but liquid nitrogen like this can flatten it.
Okay.
So we'll see how that goes. There you go. Okay.
Thank you very much.
You're welcome. Thank you.
Have a good lunch.
Thank you.